Hello everyone, this is Andy Rahatshar here. Along with my team member, we are going to present the research titled with Adaptive Architecture for Crisis, Integrating Health Facilities in Public Realm. This research reimagines public spaces and healthcare in crisis response, using Miami as a case study. It proposes modular MRT-connected healthcare hubs to serve vulnerable communities through smart planning and risk analysis. We are exploring how health systems respond during crises like pandemics, war, and natural disaster. People always rely on health facilities in this time, but many break under pressure. In 2020, when COVID hit, we asked, why did even top systems like the US struggle? And is building more hospitals really the answer? When we looked deeper, we found two key issues. Many crisis-built hospitals didn't last long, often less than 25 years. If we keep repeating this, we will just keep rebuilding instead of creating lasting solutions. In the second scenario, we saw that while temporary hospitals helped in emergencies, they often weren't practical. Some cost millions, but served only a handful of patients. That's not a sustainable solution. We have seen how public spaces and healthcare work hand in hand during crisis. Back in the 1800s, parks like Central Park were designed not just for leisure, but to help fight diseases like tuberculosis. When we looked through our precedent of research, we found UMA challenged the rigid design of hospitals, suggesting they may be more flexible, community-connected, and expandable. They asked, is building more hospitals enough? Are temporary or repurposed spaces better? Can public and healthcare spaces be merged? We explored how hospitals often spill into public spaces during crisis. So why not make that a planned, regenerative connection between healthcare and the community? It's about designing more inclusive spaces that work for both health facilities and the public realm. Here's an example of the both-way approach where a hospital in Singapore opened their spaces for public. In literature review, we looked at how recent pandemics, especially COVID-19, pushed healthcare spaces to become more flexible and adaptable. The studies highlighted the use of modular mobile units that can be quickly set up in public areas without causing major disruption. Key sources offered ideas on designing future spaces with flexibility, mobility, and adaptability to better handle future health crises. Puma's future hospital. We imagine hospitals that grow sideways like Lego, modular, prefab, and ready for sudden demand. Think nature-filled courtyard and on-site gardens for healing. Le Corbusier's Venice Hospital. We blend hospitals into cities using clusters of open, green spaces that feel calm and connected to the outdoors. Archigram's plug-in city. We see cities made of plug-in parts, hospitals, and homes that snap in and out as we change. Cedric Price's think that we rethink hospitals as mobile units on tracks, bringing care to remote or changing areas using old railways. Define the crisis. We focus on pandemic-related challenges and how architecture can support healthcare during crisis. Number two, we review literature. We gather design strategies used in past health emergencies. Number three, compare cases. We study global hospitals designed from COVID-19, focusing on flexibility, speed, and context. Number four, select examples. We pick the most relevant case studies that fit our site and healthcare needs. The design process starts with a crisis scenario, followed by site analysis to understand context. A clear problem is defined and visualized through diagrams. Solutions are proposed based on research, tested through prototypes, and evaluated for real-world relevance. The final design integrates all insights into a responsive, practical outcome. We choose Miami, Florida to test our idea, a city vulnerable to pandemics and climate disasters like floods and hurricanes, with many elderly residents and healthcare workers living far from hospitals. We explored turning Miami's elevated MRT system into a flexible mobile healthcare network inspired by Cedric Price's ThinkBelt and Artigan's plug-in city. We focused our study on maps like demography, floodplains, and transportations of Miami, where many elderly residents live. During floods or hurricanes, we asked, How will they safely reach evacuation centers or hospitals, especially if these are far away? To understand the health crisis, we first look into how Miami manages emergencies and what strategies they already have. Since crisis is a broad topic, we focused on key areas, using the 5 into 5 matrix to analyze health, disasters, transport, healthcare capacity, and evacuation centers. We found a big opportunity to connect health facilities to the MRT, especially where elderly and vulnerable people live. Our plan is to make Civic Center Station a mobile health hub that links with others and supports people during floods or crises. The first image shows how this hub works now. The second shows how it can move inland as sea levels rise in the future. These illustrations show the problem we are trying to solve and the kind of solution we imagine. We are focusing on how to connect health facilities to MRT stations, especially for the elderly and during crisis. In dense cities around the world, we see two big issues: poor healthcare access and disaster risk. We propose mobile health units at MRT stations, quick to set up, flexible, and ready for crisis care or everyday use. The idea can be adapted globally, especially in slum adjacent or flood-prone areas. We are inspired by the Bhopal gas tragedy, where trains became lifelines for emergency healthcare. That moment showed how transport can save lives in crisis. We are building on that idea, using MRT stations as ready-to-go health hubs during floods and other emergencies. To test the idea in a global context, we found that traffic and flood-like situation delay emergency care in Dhaka. So we propose modular health units at MRT stations to bring faster, safer care during crisis. Stations like Shahbag can be key hubs, linking hospitals and helping people reach care quickly. Now, if we do the same scenario analysis for Dhaka like we did in Miami, it's a different city with different challenges, but we can apply a similar solution. We reimagine metro stations as flexible health hubs that connect people to care during floods, pandemics, or everyday needs. Our goal is to build cities where healthcare is mobile, accessible, and ready for any crisis. Which led us to the quote by Buckminster Fuller: the best way to predict the future is to design it. We don't know what health crisis we may face next. Thank you, everyone.